I'm Colton from Right Physical Therapy here in Rigby. We are going to talk about some ACL tears. We're going to show you a couple different special tests to be able to decide if somebody does have a ACL tear or not. So the first one is called an anterior drawer. So you're going to place the patient's leg just like this. In this case, we're going to use the left leg. So you're going to kind of sit on the foot. That's okay. And then you're going to reach behind the calf, behind the knee, and you're going to give it a pretty good tug. You're going to tell the patient just to relax. You should feel like kind of a hard rope feeling, catching kind of that top end range. A positive test, the shin tibia here will kind of translate forward quite a bit, and there won't be that like catch feel at the end. It'll be pretty loose. Um, the next one you're going to do is called the Lockman test. So I like to take my leg and kind of put it underneath the patient's knee. That just makes me not have to support their leg so much. And then you're going to grab the shin of the tibia, same kind of thing. We're going to try and translate that forward or anterior. So you're going to go here. I like to support the femur, and then it's a quick tug there. Same kind of thing. You should get that same feel as the last test, a good band. If it's a positive test, again, you'll see some translation with that shin or tibia. Okay, the last one is a good one. If you're not sure on those two, this one's a good one to test. It's called the lever sign. You're going to make a fist, place it about halfway down on the patient's calf. You bend this leg up for me so you can kind of see that there. And then what you're going to do is you're going to place your hand right above the knee and you're going to press down. And as you see here, patient's foot should be kicking up towards the ceiling. If the ACL is torn, you're going to press down and all you're going to get is the femur going backwards and the foot's going to stay in that same rested position. So those are 3 tests to do. If you're unsure, please send them our way here to physical therapy. The other thing with all the information and research articles that we gave on the sheet you guys have, early intervention for ACL tears, even getting them into PT before they go to surgery if they're a candidate for it, but it also gives us a chance to see if they can be a coper or non-coper. So if you have any questions, please reach out to us here at Right Physical Therapy. Otherwise, thank you for watching.